Hey everyone, and welcome back to The Explainer. Today we're diving into a rapidly developing, incredibly high-stakes situation that's unfolding right now in the Democratic Republic of Congo. Look, we're tracking a critical public health alert that honestly sounds like something straight out of a medical thriller, but I assure you it is a very real and a very urgent crisis. We're going to break down the timeline, the staggering numbers, and the massive containment effort surrounding DR Congo's 17th Ebola outbreak. So let's get right into it. Picture this for a second. A massive river vessel carrying hundreds of people is intercepted and just entirely halted right on the water. And we're not talking out in the middle of nowhere either. This boat was stopped just 65 kilometers, so about 40 miles, upstream from Kinshasa. Now, for context, Kinshasa is this sprawling, densely populated capital city of millions of people. Bringing a highly contagious, deadly virus into an urban center of that massive scale, that is literally the absolute worst-case scenario for public health officials. Stopping this boat before it could reach the docks was an absolute race against the clock. Now, you might be wondering how many people are actually trapped on this thing. Well, getting exact headcount on these busy river routes is kind of like a logistical nightmare. While the BBC has reported 255 passengers currently undergoing screening, the South China Morning Post actually places that number over 300. But hey, regardless of the exact headcount, we're looking at hundreds of individuals who've been sharing super close quarters on a riverboat for weeks, and all of them now need to be carefully monitored, tested, and supplied with basics while completely isolated from the mainland. It's a huge operation. All right, let's dive into part 1, Journey of the Yingfeng 2. So how did we get here? This crisis has actually been brewing for weeks. Like a giant puzzle, it started 22 days ago, when the vessel, which is operated by a Chinese company and named the Yingfeng 2, departed from Mongala province in northwestern DR Congo. Initially, there was 0 known Ebola cases in Mongala, but things escalated fast. A passenger had been traveling on the boat for days before showing symptoms of fever and diarrhea. He was rushed to a hospital in the Papimu health zone, where on July 25th, his death was officially reported as a suspected Ebola case. By the time authorities mobilized, this boat had already traveled more than 1,700 kilometers downstream toward the capital before finally being intercepted near the Bendi port in Maluku. And here is where things get really heavy. The tragic reality of the 1,700-kilometer journey is that the 32-year-old passenger wasn't the only casualty. Right now, a total of 5 deaths are tied to this specific outbreak on the boat. Alongside him, 2 other adults, a 3-year-old child, and just devastatingly, a newborn baby have lost their lives. It's a very solemn reminder of exactly how unforgiving this virus can be, and it completely explains why the government triggered such a massive public health alert to intercept that vessel.
Which brings us to part 2, the containment operation.
Okay, so to prevent a breach of the capital, the Congolese Health Ministry and the World Health Organization kicked off a rapid response 3-step action plan. Step 1, intercept the vessel offshore. This is strictly by the book, completely in line with WHO standards to prevent any potential spread into the city. Basically, the boat is literally quarantined on the water. Step 2, they deployed a mobile laboratory directly onto the vessel itself. This means they can collect samples from anyone showing symptoms and test them right then and there without having to transport potentially infectious material across land. And Step 3, non-stop clinical screening and temperature checks to safely monitor everyone through the virus's 21-day incubation period. You know, the entire success of this operation hinges on that 21-day incubation timeline. Health Minister Roger Kamba actually hit the nail on the head when he said, "For now, no one has tested positive, and it is likely no one will be positive after 21 days of incubation has elapsed." It's a cautious but definitely hopeful message. Since the vessel departed 22 days ago and they're rigorously monitoring everyone on board, the Health Ministry believes that if they can just ride out this incubation window without any new positive tests, they might actually prevent this specific cluster from breaching Kinshasa.
Now, let's zoom out a bit for part 3, the broader Bundibugo outbreak.
The Democratic Republic of Congo has been fighting its 17th Ebola outbreak since May 15th. But guys, this isn't your typical strain. They're up against the Bundibugyo species. This is a super rare strain of the Ebola virus that literally hadn't been seen anywhere for more than a decade. And here's what makes this so incredibly dangerous. Unlike some other strains of Ebola where we've seen some major medical breakthroughs, there are currently no specific drug treatments that target Bundibugyo. There's no approved vaccine. Local health workers are essentially fighting this thing out there without their most powerful modern tools. And the numbers, they're frankly staggering. It's been just 3 months since this outbreak was declared, and official figures show 3,973 confirmed cases, resulting in 1,801 deaths. Let that sink in for a second. This is now officially the second deadliest Ebola outbreak in history. More than 17,000 people are actively under monitoring right now just for coming into contact with Ebola cases. There are 674 patients currently in isolation or treatment across 5 different provinces. Now, thankfully, we're also seeing 776 recoveries, but the sheer volume of cases really shows you just how rapidly this rare strain is spread like wildfire through the region. Okay, moving on to part 4. The race for a vaccine.
So where's the silver lining? Well, the great hope right now lies in experimental medicine. Because Bundibigo hasn't shown up in over 10 years, vaccine development had kind of just paused. But now, the very first human trials for a Bundibugo-specific vaccine are actually underway over in the UK. This is huge. It's a massive, proactive step to finally try and build a safety net for health workers and vulnerable populations who are, quite frankly, completely exposed right now.
And what's amazing is seeing the response come together through a mix of global and local pushback. On the global side, you've got people like 37-year-old Ed Hunt from the UK. He literally volunteered to receive this new experimental vaccine after watching news reports of the devastation in DR Congo. Also, the UK recently evacuated a humanitarian worker back to a London hospital just for monitoring after they were potentially exposed to the virus in Congo. Meanwhile, back on the ground, preparations are intense. Authorities have heavily reinforced surveillance and rapid response teams right at Maluku, which is exactly where that riverboat was stopped, because it serves as the main entry point into Kinshasa.
So, what does this all mean for the future? It brings us to the ultimate question. With over 17,000 people currently under monitoring, a massive riverboat completely quarantined offshore, and human vaccine trials only just getting off the ground, can DR Congo effectively contain the second deadliest Ebola outbreak in history? It is an absolutely massive public health challenge, one that requires perfect coordination, immense resources, and time that they simply might not have. We'll be keeping a very close eye on this outbreak and the fate of the passengers on the Yingfeng 2. Thanks so much for joining me on this explainer today. Keep questioning, keep learning, and I'll catch you in the next one.